But roughly, the babies this age have about 7 feeds in 24 hours, and they use both breasts. So
at each feed?
Yeah, generally at each feed. Once they're over that first 72, 96 hours, they go to two-sided feeding, and then what happens is they fill their stomach to their own satisfaction, and only we can do that by observing them. Then when they've reached that level of satisfaction, then they rest for that milk in the stomach now, which has expanded the stomach slightly, not over-expanded it, because she knows when she's satisfied. And then that curdles with the enzymes. The enzymes make it cottagey, cheesy-like inside, and then it transfers by peristaltic wave into the intestine. As the stomach level drops, you'll start to see her get busy again. And she's looking and she's smelling and she's touching and the longer you go, the tongue protrudes to try and locate the nipple, and the voice starts to call. And if you leave it a little bit longer, the voice gets louder and louder. So generally when they're getting busy again, I suggest a nappy change then, because then if you nappy change at the beginning, they come to the breast crying, and if you nappy change at the end, you wake them from that lovely, when they're heading towards their sleep state. So then when she asks for the second breast, she goes to the second breast and she refills her stomach to satisfaction again. So the capacity that she needs, and her stomach's about the size of her closed fist. So it's not a lot of capacity, but sometimes, you know, it can be a little, they just know when they're satisfied. And you may see a fine tremor at the lip and chin, and that's that neurological response to the brain from the stomach to say, I'm satisfied. Then they stay there and they just nurture. And I talk about that as being the emotional part of the feed. So they've reached caloric and volumetric satisfaction, and then they just don't want to give it away just yet until they're emotionally satisfied, and then they slip off. And that takes about an hour, roughly about an hour. So that's how they fit in about 7 feeds in 24 hours. And each 24 hours might be different. It's not the same pattern all the time. It just depends on what her calorie needs are. And you can, if you check her nappies each time, you'll see what's coming through, and you'll be able to assess that yourself on a level of 1, 2 or 3, 1 not being very much, 2 being moderately and 3 being a lot, wheeze or poos, and you satisfy your own knowledge about how your baby's, you know, working with feeding and sleeping.
Right.